Okay, good afternoon, everyone. My name is Juliette Palin. I am a community engagement specialist from the Department of Public Health Preparedness Program. Thank you for joining us this afternoon for our Breathe into Fall Respiratory Health workshop, staying healthy and prepared during the fall season. This is the second workshop of 2022 for our seasonal schedule for the preparedness program as we help communities prepare for public health emergencies. Before we get started, I wanted to go over how to use the interpretation services and ask questions. You will see our ASL interpreters, Sarah Campbell and Megan Mieres, pinned to the top of the screen. To participate in this session in another language, click the globe icon at the bottom of the screen, and you'll see the different channels that are available. And you see a picture of it on our screen. There are 5 different languages: English, French, Mandarin, Vietnamese, and Spanish. You can tune into in order to hear the workshop in that language. Thank you to our interpreters. And I want to encourage you to ask questions throughout this session. You can type them into the Q&A box as seen on the screen. We will answer the questions at the end of the session or throughout. We'll either type them back or take a pause to answer the questions. If you are calling in and your questions are not answered, you can email publichealthpreparedness@phila.gov or call us at 215-429-3016. Again, everyone, my name is Juliette Palin, Community Engagement Specialist from the Department of Public Health. Along with me presenting is Shaniqua Andrews, Health Educator for the Preparedness Program, and members of our team will be assisting with answering questions throughout the workshop. We are part of the Preparedness Program, and we help communities prepare for public health emergencies like seasonal flu and COVID. Today, we will talk about the fall season, respiratory health, the importance of understanding how viruses change over time, comparing and contrasting seasonal flu and COVID. We'll go over why you should test and the different treatments and preventative measures that are available. And then we'll go over COVID-19 testing resources and some public health resources, and end with questions. And again, I just want to remind everyone to feel free to utilize the Q&A box to ask questions throughout the webinar. Okay, so let's get started. Fall is here, and in Philly, I feel like the cold weather made itself known, except for today. It is a little warm, but the leaves are changing and the air is becoming crisp. People already suffering from breathing problems have a difficult time come fall. The cooler air can cause a variety of triggers affecting the nose and sinuses or airway constriction in the lungs. So we will discuss ways to hopefully help you be able to better breathe into fall and enjoy this new season. Respiratory diseases are very common in the fall. This may be caused by infection or people whose jobs and living conditions expose them to respiratory illnesses. And so some of those common respiratory diseases we see include seasonal flu and COVID, which we will talk about later, but also COPD, lung cancer, asthma, and more. While the weather can play a huge role in respiratory illnesses, there also are many environmental exposures that can increase difficulty with respiratory illnesses. And so people whose jobs and living conditions expose them to respiratory complications are really high priority when we talk about preventing serious illness. Things like less access to medical care, living in older homes with lead paint and asbestos, not having access to healthy foods, and poor quality air in neighborhoods can cause respiratory disease and lead to greater complications when exposed to a virus that affects the respiratory system. And so these factors I've listed on the screen affect a large amount of people of color in Philadelphia. And so it's important that people exposed to environmental contaminants take extra care of their health during this season. So you may be wondering, why are we still talking about diseases like flu and COVID-19? It's important for us to talk about respiratory disease because it is the fourth leading cause of death in the US. You can play a major role in preventing and relieving symptoms of respiratory disease. So we just want to make sure that you understand risk factors so you can stay on top of your health throughout the fall. I am now going to pass it over to our health educator, Shaniqua, who will talk about seasonal flu and COVID-19.
So seasonal flu and COVID-19, we're going to talk about the virus mutations of the two. So virus mutations is normal and expected. In order for a virus to survive, they need a host. That host is the cells within our bodies. Once the virus enters our body, it starts to reproduce and spreads. The more a virus circulates in a population of people, the more it can change and mutate. This change in the virus causes different variants of the disease, which can make the virus more or less severe. Because viruses are also changing, it's very important to stay up to date on all vaccines and booster shots. So what is seasonal flu? A seasonal flu is also known as influenza virus. It is one of the most common respiratory infections. The flu can affect the nose, throat, and sometimes lungs. Flu seasons begin around October and ends in late April. So in our last slide, we talked about how virus can mutate and make different variations of themselves, right? So the flu is one of those viruses. The most common flu types that circulate among people today are influenza A, which is also known as H1N1 virus, influenza A, H3N2 virus, and influenza B virus. What is COVID-19? So we all know coronavirus disease 2019, also known as COVID-19, is a very contagious disease. It's caused by a virus called SARS-CoV-2. As we have seen over the last 2 years, there are many variants that may mutate since the outbreak in 2019. The most current circulating variant is Omicron. So, seasonal flu and COVID-19 have a lot of similarities between the two. They both are respiratory viruses, can be spread from person to person, and they can also have similar signs and symptoms. These signs and symptoms are fever, coughing, or cold-like symptoms, or cold-like symptoms. The only way to differentiate between COVID-19 and the flu is by testing for both. So, how does these two spread? Ways in which both viruses spread are droplets. So say if someone is coughing and you walk past them, those droplets are now on you. So you can breathe them in and become infected. Another way is by touching objects or surfaces in which the virus are on. So if you touch a doorknob in which someone just wiped their nose and you touch that doorknob, now that those germs are on you, and you may touch your eyes or nose, and now you become infected. Also, people infected with COVID-19 or flu may not feel any symptoms and can spread the virus to others before they even know that they're sick. So common symptoms between flu and COVID-19 can range from no symptoms to mild symptoms to even severe. One of the most common symptoms related to COVID-19 is changes in lost taste or smell. It can also be presented briefly in people with the flu as well. Testing is needed to see if you have COVID-19, the flu, or possibly both. So, seasonal flu and COVID-19 can affect people in many different ways. People at higher risk for experiencing severe complications due to these viruses are older adults, typically seniors. They make up vast majority of hospitalizations. You have people with underlying conditions, such as heart conditions, cancer, diabetes, high blood pressure, HIV, weakened immune system, respiratory diseases, such as asthma, COPD, lung cancer, and more. Pregnant women and recently pregnant people also are at high risk, infants and children. So anyone experiencing any sicknesses should reach out to their primary doctor. It's especially important that those who fall into any of these categories reach out to their primary doctor if they should have any symptoms or severe complications. This is so they can be aware of what's going on and what treatment options are best or necessary for you. Also, wearing a mask when in crowded areas and washing your hands can help prevent getting the flu and COVID-19. If you have a loved one that falls into either one of these categories, make sure you're checking on them during that time. So there are differences between flu and COVID-19, especially when it comes to the complications. They both are very critical. For example, a person with the flu could get pneumonia, while someone with COVID-19 could experience long-term damage to the lungs and or other long-lasting symptoms. COVID-19 can affect people more severely, and it's important to contact your primary care doctor if you experience any symptoms.
Thank you, Shaniqua. Before we move on to the next section, I'm going to stop and see if there's any questions in the chat.
There are currently no questions in the chat.
Okay, thank you, Roger. So Shaniqua just talked about those who are at risk of serious illness, the symptoms that many of us are familiar with, and some complications that occur. If you've had the flu or COVID, you know that most people can treat themselves at home. So rest is important so your body can fight off infection. Hydrating, drinking lots of water, juice, tea, and soup. If you had a grandmother like mine, when the doctor said drink fluids, ginger ale was the best medicine. She swore by. So making sure that you are drinking lots of fluids because symptoms of COVID and flu both increase dehydration. And then lastly, you can medicate. Over-the-counter medications can help with some symptoms. People with mild illness or who are not at a high risk of complication may also be treated with antiviral drugs by their doctor. And we'll talk a little bit more about those in the next slide. But it is essential that as soon as symptoms begin, to speak to your provider about the best treatment option for you. People who are at risk of serious illness, speak to your provider about potential symptom treatment and management. And that's what this slide talks about, the different treatment options for flu and for COVID-19. I mentioned antiviral in the last slide. There are antiviral treatments that you may be eligible for that need to be taken within 2 days of feeling sick, and monoclonal antibody treatments that can also help reduce serious complications. Again, it's essential if you have other chronic health conditions to speak to your provider about the best treatment options. We keep saying talk to your provider throughout this presentation because having a primary care provider is the first step to making sure you're healthy. It's important to have a primary care provider you trust to answer the questions, your questions and concerns. And so a primary care doctor, as we know, can help you stay healthy and then can be the first to treat any health problems that arise. And on the screen, you'll see the website that we have to find a primary care doctor. It's www.phila.gov/primary-care. And so you can go to this website to find a free or low-cost medical care, even if you don't have insurance. Also, all of these city health centers offer phone interpretation services. Some also offer in-person interpretation. So I'd recommend visiting that website to view each location's details for the list of languages spoken by staff. And again, if you don't have a primary care doctor or a primary care provider right now, we really encourage you to find someone before you get sick so you are comfortable talking to someone who can help you, make you feel better. And so we know that flu and COVID can affect people differently. We talked about that. While some people may have no symptoms, some experience mild symptoms, others can also experience severe complications. It's really important, especially if you or your loved ones are at risk of severe illness, that list that Shaniqua had mentioned, you seek medical attention immediately. On this slide, here's a list of flu symptoms that would be concerning. So difficulty breathing or shortness of breath, dizziness, severe weakness, temperature or fevers over 104 for children, or not returning to normal temperature after some time. And so we recommend if someone is experiencing these symptoms to call 911 immediately. And I'll go to the next slide, which shows concerning symptoms for COVID-19. And there is some overlap. So again, we'll see that trouble breathing, persistent pain or pressure in the chest, discoloration in the skin, nail beds and lips. For both of these slides that I went over and talked over, this list does not include all the possible symptoms. And so please call 911 for any other symptoms that are severe or concerning to you. There's really no need to try and sit and guess what symptoms are bad or serious. Just seek medical attention to make sure that you or your child or your loved one gets the proper care that they need. So as we enter flu and COVID season, we must continue to be vigilant. The best ways to protect yourself is getting the vaccine, and we'll talk a little bit more about those vaccines in the next slide. But also we still need to remember to wash our hands often, cover your cough and wear a mask, especially if you are indoors around a lot of people. And if you need masks, you can visit bit.ly/free N95s to receive free masks. Next, stay home if you are sick. Don't try and push through and go out. It's best, to get your rest and stay at home so you don't get others sick. And then lastly, sanitize frequently touched surfaces. As I mentioned, vaccines are great ways to protect yourself from flu and COVID. You can actually schedule both vaccines at the same time. The flu vaccine is updated every year to protect against types of flu expected to be the most common and dangerous. On the slide, we have the bit.ly for flu PHL. And this website can help you find flu vaccine and healthcare providers in your area. Again, that website is bit.ly/flu-PHL. The next slide, I'm going to talk about the updated COVID vaccine booster, the updated booster. And this is for those who have already received COVID vaccines at least 2 months ago. You're now able to get the bivalent booster. And so the bivalent booster will help boost your immune system and protect you from getting severely sick or passing the virus. It's known as the updated booster. It contains a combination of the original booster with updated protection against the types of COVID-19 that are most contagious. And so I know as we talk about boosters, you might be feeling like, ugh, another booster. But it is expected that viruses like influenza and COVID-19 will mutate and change as they spread. So there will continue to be updated versions of COVID-19 vaccines, and likely it's going to become a routine part of seasonal healthcare, similar to the annual flu vaccine. If you have any questions about the bivalent vaccine, we have frequently asked question materials and more to help you understand the new vaccine so you can make informed decisions on what is the best way to protect yourself. And we'll go over a little bit later in the slides how to get some of these materials. This next slide has the website for COVID-19 vaccine clinics near you. You can visit phila.gov/vaccine or vaccine.gov to find free COVID-19 vaccines at our health centers, pop-up clinics. And again, you don't need to have insurance to go get the COVID-19 vaccine. I am going to pause before we get into the city COVID-19 city resources and see if there are any questions.
Juliet, hi, this is Becca. There is one question that's related to the content that you just were talking about. And that's the question of would undocumented immigrants be able to access these resources, or is an ID or medical insurance needed to access them? And the answer to that is for all city resources, you don't need an ID, you don't need insurance, and you don't need any documentation at all. So this is true for both testing and vaccine. Everyone is welcome. For COVID-19 specifically, vaccines are free for everyone in the US, regardless of your immigration or insurance status, and regardless of where you get vaccinated. So if you have insurance, you may be billed, but your insurance, you should not be charged for a COVID vaccine at any time. I think that is that. There's another question here about masking that we can get to if this is a good time.
Yep, sure.
So the question that someone asked was, some concerns I have about COVID and respiratory infections are how to mask properly. So the main rule for masking is really to find the most protective mask that fits you well and that is comfortable enough for you to wear consistently. That's the most important rule. You need to wear a mask that fits snugly over your nose and your mouth. But the type of mask really depends on your risk level. So if you're at higher risk of serious illness, you should consider wearing a more protective type of mask, like a KN95 or an N95 if possible. Or you can wear 2 disposable masks together. If you're someone who's less at risk, you can probably just wear a disposable mask and that should be fine. We'll share a link to some really detailed information about masking from the CDC that has pictures and more information about all of that material. And I think Juliet and Shawnee, you can go ahead. Those are all the questions that are relevant to the content you just went over.
Great, thank you, Becca. I'm going to pass it over to Shawnee, and you can talk about COVID-19 city resources.
Thank you. So COVID-19 and city resources. So we know that during the flu season, COVID-19 continues to be a concern. So it's very important to continue to test for COVID-19. Again, you cannot tell if you have the flu or COVID just from your symptoms. Testing is needed to tell if someone has one or the other or both of the viruses. Ways to get tested. You can take a rapid COVID-19 test. If the results are positive, you can contact your primary care doctor just to let them know of what's going on, what symptoms you are experiencing. Let those around you know that you have a positive test result, just so that they are aware, the ones you come in frequent contact to, even if it's in your household or outside. Current guidance says that you should isolate from others for 5 days. High risk population may have to isolate longer. Consult with your doctor or have them consult with their doctor to find out. And then other testing resources are, you can get a free COVID-19 test, even if you do not have insurance. And that website is bit.ly/COVID resource hubs. Another thing is, like I said, some health insurance companies are required to reimburse 8 at-home tests per month, I'm sorry. And that website is go.cms.gov/3LQO0YK. And we will be providing these resources in a follow-up email as well. I'm sorry, and I didn't go over the negative testing result. If the person tests negative, but you are having symptoms, it's best to stay home for at least 24 hours after your fever or symptoms are gone, along with contacting your primary care provider. Some resource hubs. PDPH has COVID-19 resource hubs around the city that distributes at-home test kits and provide other resources. These resources are Bethany Baptist Church. You have My Salud Wellness Center, Mount Enon Church, Whitman Plaza, and Shopee at LaSalle. And of course, you can go back and, like I said, you can visit that resource link, which is bit.ly/COVID resource hubs for locations and resources or hours of operation. Mobile testing sites are also available to get at-home testing kits and other resources as well. Here are a list located around the city. They are open Tuesday through Saturdays. Okay, so we're going to take a moment to have a breath. So we want to acknowledge that COVID-19 has shifted the dynamic in which we live, both physically and mentally. Your mental well-being is just as important as your physical well-being. So breathing exercises are one of the great tools that we can use to enhance our lung function, increase respiratory muscle strength, and relieve stress and anxiety. So we're going to take a moment to do a breathing exercise, but before we start, I'm going to model how to do a breathing technique, and then we'll go into the activity. So we're going to breathe for 5 seconds, and this is breathing in for 5 seconds. And then we're going to breathe out for 5 seconds. And this will be 4 sets. So it'll be in and out. And then we'll do that for 4 sets. And here's the video. So breathe in, inhale. And breathe out. Then we're going to breathe in. And we're going to breathe out. And breathe out. I'm sorry. And breathe in. And breathe out. And breathe in. And breathe out. So I hope this exercise made you feel a little relaxed and a little calm. And you don't have to do it as fast. You can do it at your own pace. It's great to do when you just need a moment to yourself to collect your thoughts. So that's one of the activities that you can do on your own. So again, your mental health and well-being is very important. During this time, fall in love with taking care of yourself, which includes your mind, body, and spirit. If you or anyone you know is experiencing a mental health crisis, please call 215-685-6440. Also, interpretation is available 24/7. Or feel free to go online for behavioral health screening and other resources by visiting healthymindsphilly.org. A newsletter with mental health and wellness resources will be provided in a follow-up email.
Thank you, Shani, for going over those breathing exercises with us. Before we let you all go, we just want to let you know about our material request. If you would like more information and resources like flyers to distribute out to your community, you can visit bit.ly/PHP materials. The fall materials will be updated soon if you go to that link, and you will see pictures of our newsletter below. You can also check out our website for additional resources at bit.ly/PDPH preparedness outreach. Again, you can request a number of materials in different languages. And we will follow up with the printables in the email that we send out next week, along with the recording. And again, to stay connected with us, you can reach us at public health preparedness at phila.gov, or leave us a message at 215-429-3016. If you have not yet, join the Community Response Partner Network, to receive critical information during public health emergencies. And you can do that at bit.ly/PHL Community Response. And lastly, if you would like up-to-date alerts on public health emergencies from the Office of Emergency Management, you can text Ready Phila to 888-777 or visit phila.gov/ready. So we thank you all for your attendance and attention. Again, you can expect an email from us next week with additional materials from the information that we went over. We will now take time to answer some of the questions that came through on the chat.
Thanks, Juliet and Shani. There were two other questions we didn't get to yet that came in on the in the registration. So one of them asks, at present, it seems like children are having a lot more respiratory issues than normal. Is that correct? So the general answer for this, not specifically for children, is that we are seeing signs that this year could bring more respiratory infections, which would include children. This is because social distancing, masking, and other precautions that we all took to prevent the spread of COVID also prevented the spread of other respiratory infections. So now that more people are traveling and socializing and many restrictions have been lifted, more virus will be passing from person to person, and this can cause more illness. So this is just another important reason why it's so important to get your flu and COVID vaccines, to protect yourself and others from getting sick with masking, washing your hands, staying home when you're sick, and all the other ways that we try to keep ourselves and others safe. The last question that was asked in the registration was, what can an asthmatic do in the prevention of COVID-19? So for prevention, you would follow the same guidelines as everyone else, just more carefully, mask in crowded spaces, cover your cough, wash your hands, get vaccinated, and remember that if you have a chronic lung condition like asthma, you may be more susceptible, you may be more likely to get a respiratory infection. But one of the most important things you can do that we talked about earlier was to work with your healthcare provider. And if you don't have a healthcare provider, to find one using the resource that we'll send you in that email. A doctor or a provider that knows you can help you understand what triggers your asthma and sets it off, how to avoid triggers, how to avoid having exacerbations of your asthma, and how to use your medications to keep your asthma under control during the colder months. If you do get sick, it's important to contact your healthcare provider so they can help you manage your illness. They'll know you, they'll know what's going on with you in particular, and they'll be able to let you know what you need to do and when to come in for a visit if that's needed. So those were all the questions that we received. We got a thank you from Hannah. Thank you, Hannah, for your thank you.
I do see one more question
Okay.
here. It's about the recording shared on YouTube. We will have the recording in all the languages that were interpreted during this session. So those will also be posted. And I think that's the last question. If there's any more coming in, we'll wait a few minutes. Seeing none come in, thank you all for joining us for our fall Breathe into Fall webinar. Look out for more details on materials that you can send out to your community members and friends and family so that you can stay informed for the next public health emergency. Have a great rest of your day.